Well, good morning. Welcome to the White House on a beautiful, beautiful fall afternoon here. My name is Tina Chen. I am the director of the White House Office of Public Engagement. We are the outreach office here at the White House, and it is really our pleasure and our honor to welcome you here today for really a very, very important conversation on the public health benefits of our a green energy economy, which is a clear priority for the president. Let me introduce on my staff, Greg Nelson, who is right here. Greg does our environmental outreach. He's been pretty busy, as you might guess, over the last several months here, and he will also kind of be your guidepost for logistics. I really want to thank you because you've all not only taken time out of your busy schedules, but you've taken a sizable chunk of time out of your busy schedules to participate in this, not just in our opening sessions here, but then in the breakout sessions to come over at the White House Conference Center. And it was important for us to have this large commitment of time and effort so that we could have a real conversation and input from all of you, because you are all important stakeholders both in the public health area, in the environmental justice area, and people who have studied this issue, and getting your input is very important to us, and hopefully getting any questions that you may have answered about what we're doing on these issues here in the Obama administration is something you'll get a chance excuse me, to ask and have those questions answered. We are web streaming this live, so for those of you on Twitter, if you want to Twitter that out to your colleagues or any of your members or constituents that you may have to follow along, there's a chat going on Facebook as well that's following this conversation today. So if you have folks out there that you want to let know to tune in and participate in this across the country, yeah, they are welcome to do so, and we hope that they will do that. One of the things we're committed to do, and the name of our office is the Office of Public Engagement, which is a change from its prior name of the Office of the Public Liaison, is we want to engage the public at both the grassroots level and grass tops, and not just here in Washington, but across the country. And this issue in particular is one that affects all of us in all of our communities. Obviously, green jobs, clean energy is important from an environmental point of view. It's important, as the president has said, from an economic competitiveness point of view for the country. But as you all know, and as we want to talk about today, it's really also about people living in healthier communities, living healthier lives. The overall health of our nation and the world rests on this clean energy, green movement that the president is so invested in. We have a wonderful lineup today. We will have Administrator Lisa Jackson is here, Secretary Sebelius is here, as well as senior staff from both the EPA and HHS. And I want to really give a thanks and acknowledgement to the staff in both of those agencies for the hard work that they have done together with folks at the White House to put this together and to keep this conversation moving forward. So they have been great leaders on this, and you have a great opportunity today to hear from them all. But to start us off, I want to introduce John Carson, who is the Chief of Staff for the White House Council of Environmental Quality. Some of you may recognize John as a familiar face as the former field director in the campaign, but some of us knew him from that and didn't know that he's also a trained engineer, and as I've been told, a policy wonk on these issues. And so his position now at the top at CEQ is perfect for him, and he's a great person to lead us off today. So John?
Thank you so much, Tina, for kicking this off, and thanks so much to all of you for being here today. I know we have public health experts, a number of community leaders, business leaders. We're so excited to have you here today to talk about this nexus of these two crucial issues, public health and the global warming crisis. As the Chief of Staff at the Council on Environmental Quality, one thing I can assure you of is the President's commitment to leadership on the fight for a new energy future and public health and environmental protection at the same time. It's a vision that the President and the Cabinet Secretaries and all of us here in the administration share of a new energy future, creating new jobs in the clean energy field, but at the same time improving our environment and improving public health at the same time. And I think what this really means is that while addressing climate change is this enormous challenge in front of us, it's also this enormous opportunity, both for our health, for the economy, and today we're going to talk about the issues involved in that and how we're going to make this happen. And just weeks after this administration started, the President really won an enormous victory in the Recovery Act, which takes a lot of these ideas and makes them concrete. We're going to talk a little bit today about how some of the specific programs, over $80 billion in new energy investments, are making some of these ideas real and concrete. These investments are laying the foundation for lasting prosperity. Some specific examples are developing new battery technology, which at the same time as reducing greenhouse gas emissions are improving air quality and thus public health, modernizing the electric grid to bring clean, renewable energy onto the grid, making homes and businesses more energy efficient, and doubling our capacity to generate renewable energy. We've seen also at the same time significant movement on the fight for climate and energy legislation. The House passed a historic bill this summer, and even as we gear up for a health care vote in the next few days here, we're seeing very good movement towards energy legislation as well. To sum it up, the President's vision is really about, at the same time as tackling global warming, taking inhalers out of children's pockets, clean rivers and lands that will thrive next to clean energy and renewable energy, and the American jobs that will pay living wages and provide benefits for American families. It's about both our nation's health and wealth at the same time. So it's an honor to be here with our two first speakers today, Secretary Sebelius and Administrator Jackson, who can speak clearly about this nexus between the challenge of global warming and public health at the same time. I can tell you that after 11 months of this administration working with both of their staffs, working hand in hand on a number of issues, at this crucial nexus of the fight over climate and energy legislation, public health, and environmental protection, we couldn't have two stronger leaders than Secretary Sebelius and Administrator Jackson here to help us lead this fight.
Well, thanks, John, for that wonderful and kind introduction. And let me join John in welcoming you all here and thanking you for coming this morning. In a minute, I'll have the honor of introducing my colleague, Secretary Sebelius, so I'll say that, but it's wonderful to share a stage with her. She and I are both passionate defenders of the need to make sure that health is a vital part of the conversation when we talk about clean energy. I know a lot of you have traveled long distances to be here with us today, and we're glad to have you. We're here to reinforce a very important idea, one that many of you have been helpful in expanding on and that we know you'll continue to expand on. Environmental protection and energy reform are not just important for stopping climate change and creating clean energy jobs. They are also critical elements in protecting the health of our communities. I would even say that reducing pollution in our communities is reason enough to reform the ways that we harness and use energy in our country, but there are a couple of other good ones too. Protecting our health is at the root of the work that we do at EPA and that many of you in the environmental and public health community partner and champion on our behalf and on behalf of the communities that you serve. When the environmental movement really got its start in the 1960s, people were concerned with big public health problems. I would sometimes say big flaming public health problems, rivers literally on fire and air that was so polluted you could literally see the pollution. They were concerned about the water that they were drinking and the chemicals that were on the food that they and their families were consuming. Environmentalism started because of concerns about public health. And today those issues are equally a part and still a definitive part of what we do. Today we see cancer, heart disease, and respiratory illnesses, 3 of the 4 top deadliest illnesses in the U.S., responsible for more than half of all deaths, and all 3 have links to environmental causes. We see scientific studies that smog, mercury, and other pollution can lead to developmental disorders and premature birth. We read reports about babies being exposed to hundreds of different chemicals before they are born. Chemicals from pesticides, fast food packaging, coal and gasoline emissions, and trash incineration. We put them into the air or the water on the land, and they end up in our bodies, and they affect the most vulnerable among us. We see 23 million people in the United States suffering from asthma, including almost 1 in every 10 kids, making environmentalism a critical children's health issue as well. One of those children is my 12-year-old son, Brian. Brian's fought with asthma his entire life. Oh, and he's 13 now. His first Christmas was spent in the hospital. He was unable to breathe. Being a mom at the bedside of a child who's literally fighting to breathe and not knowing, can't even talk yet, can't even explain how he feels, wondering how and when the next episode would happen, laying in bed at night, even at age 13, when thankfully, through good health care and prevention and intervention, his asthma is well under control. I still, if I hear him stirring in the middle of the night, get up, because I know the beginning of that croupy cough and that pattern of putting him in the hot shower, taking him outside, hoping to avoid an emergency room visit. So I come to this issue not just as EPA administrator, but as a mother. And finally, we see the truly devastating effects on some of our most vulnerable populations, the poor and minority communities that bear the burden of environmental degradation face disproportionate health effects as well. African Americans die from asthma twice as often as whites and have higher cancer mortality rates than any other group. Or the nearly 30 million Latinos, about 72% of the U.S. Latino population who live in places that do not meet U.S. air pollution standards. Right now, we have an unprecedented opportunity to get America running on clean energy and significantly reduce the pollution in our air, in our water, on our land, so we can attack these enormous health challenges. And in these last 10 months, I'm proud that we've done more for clean energy in this country than has been done in the last 10 years. President Obama has pledged to double our use of renewable energy in the next 3 years and cut carbon emissions by more than 80% by mid-century. He's challenged federal agencies like ours to lead by example, and he's initiated the Green Gov program to ask 1.8 million federal workers and men and women in uniform about opportunities that they see to make government more sustainable. And he's put clean energy and energy efficiency at the center of our Recovery Act. In building a new foundation for prosperity, we're betting on American entrepreneurs, on American innovators, and American workers to lead the world in the race for clean energy. One of EPA's primary recovery investments has been in clean diesel retrofits on school buses, on highway vehicles, in locomotive diesel engines, and others. And we know the return on that investment. For every dollar spent in the diesel program, there's a $13 return in health benefits, 13 to 1. And the Recovery Act is just one piece of the pie. Since September 1st, EPA has announced a program with the Department of Transportation to increase fuel efficiency and decrease harmful emissions from American-made vehicles. We finalized a rule to track greenhouse gas emissions from the nation's largest sources, and we proposed a new rule to use the Clean Air Act to cut emissions from large sources by raising the standards for innovative clean energy technology on those facilities. That rule will allow us to do what the Clean Air Act does best: reduce emissions for better health, drive technology innovation for a better economy, and protect the environment for a better future, all without placing an undue burden on the businesses that make up the better part of our economy. And just last week, after years, literally, of waiting, we sent our final endangerment finding up to the White House for review. All of these efforts, of course, accompany a strong push to get a clean energy and climate bill through Congress and onto President Obama's desk. The benefits of that will not only be a declining cap on carbon emissions, but an established investment environment for clean energy. These are win-win changes for our health and our environment, like installing cogeneration units at a manufacturing plant or mass transit expansions. They require large upfront investments, and an established program of reforms and incentives can help get the market to work, making clean energy the profitable kind of energy, and setting us on course toward the health and environmental improvements we all need. Today's breakout sessions sound exciting. They're designed to spotlight particular types of energy efficiency and clean energy changes that reduce the air, water, and soil contamination that affect our health. We hope for some good discussions today, but we also hope that in the days and the weeks ahead, you'll come back to us with ideas and opportunities from your communities. This should be the beginning of our work together. As we engage in historic debates about the future of our health, our environment, and our energy, we need to send the clear message that there are links between clean energy and a clean bill of public health. We should be talking about how much we pay at the pump, and we should absolutely be talking about the future of our planet. But our discussion would be incomplete without talking about a little boy who has asthma and can't go outside and play on a hot summer afternoon, or an urban business owner who has to pay higher health care premiums because her workers get sick more often, or a pregnant mother who is breathing in dangerous smog each and every day. Energy reform and environmental protection can be an ounce of prevention that makes a huge difference in our public health future. And I thank you for being here today to help us send that message. Now, I'm very proud and honored to introduce a colleague, a partner, and a friend. As the Secretary of the U.S. Department of Health and Human Services, she literally embodies our ongoing mission to improve America's health, the health of America's communities. So I'm so pleased she could join us today to talk about the connections between these issues. Ladies and gentlemen, Secretary Kathleen Sebelius.
Well, good morning, everybody, and thank you, Administrator Jackson, for not only that nice introduction, but more importantly, for your incredible leadership at this historic time. You know, it's a little intimidating for me to join Lisa on the stage today talking about climate change issues. It's like being at a software conference following Bill Gates, but I'm pleased to be here nonetheless, and glad really that we could get together today to talk about this because it's becoming clearer and clearer that the consequences of carbon filling the sky go well beyond harm for our planet. There are national security consequences to our actions. Relying on fossil fuels, we're giving a lot of power to countries who frankly don't like us very much. And we can think back as recently as last August when we were facing $4 a gallon prices at the pump. We had no real alternative here within our national boundaries, and we were not able to stabilize our own market. So the longer our country runs on fossil fuels, the more we'll have to worry about the possibility that countries on the other side of the world could cut off our energy supply. There are consequences for our economy, clearly. As President Obama said earlier this year, from China to India, from Japan to Germany, nations everywhere are racing to develop new ways to produce and use energy. The nation that wins this competition is the nation that will lead the global economy. So if we stick to old ways of making and using energy, we fall behind. Now, I came from being governor of Kansas to the position of Secretary of Health and Human Services, and I can tell you in states across the country this realization is underway. My home state of Kansas has one of the heaviest carbon footprints per capita in the country, But we also are the home of the prairie winds. Kansas, even when the legislature isn't in session, is regarded as the third windiest state in the country. So looking at that possibility, we made some decisions to move away from fossil fuels and focus on our homegrown advantages, deciding it was really time for a change. And when I left my position, we had battled the construction of 2 new coal-fired plants and tripled the amount of wind energy in our state. And those kinds of dynamics are going on across the country. Americans, as citizenry, are beginning to understand the challenges. You hear policymakers, but more importantly, regular folks on Main Street and around kitchen tables and in their grocery stores having conversations about the fact that this isn't just an environmental concern. They understand it's about energy independence, and they understand it's about global competitiveness. But here today, we're talking about a topic that's been a little slower to be recognized by Americans, but I think it's very compelling, and that's the health consequences of what's happening in our environment, the consequences for not only the health of adults, but as Lisa has so compellingly talked about, the health of our children and grandchildren. You've already heard about some of the research on public health costs, and we've seen results in cities and states around the world. When greenhouse gas emissions go down, so do deaths related to respiratory and cardiovascular disease. In Atlanta, when the Olympics were held in 1996, they developed some new measures to cut down traffic in the center of the city to try and let the Olympic Games move with greater agility. And then they were curious after the fact if there were any health consequences to that decision. When they went back to look, it was fairly astonishing. Asthma hospitalizations for kids were down by almost 40% during the period of time that they reduced that traffic flow. Now picture those kinds of reductions in every city in America, and you can start to see why the National Academy of Sciences has estimated that we could save $120 billion a year in health costs if we stop burning fossil fuels. To put that number in perspective, as my kids used to say, a gazillion dollars. It's hard to kind of measure. But that's 6 times more the annual cost of asthma in America, and it's more money than we spend on all the cancers put together. So it's a significant amount of dollars. And there's no longer any doubt that fossil fuels harm our health. We know we still have a lot to learn, and that's why the Department of Health and Human Services continues to support research on the connections between greenhouse gas emissions and public health, especially through our Institute of Environmental Health Sciences. In fact, there's some very compelling research coming out next week. So if you're interested in learning more about the health costs of our fossil fuel addiction, I'd encourage all of you to go out and get the latest issue of a journal many of you probably know called The Lancet. If you find the research to be as striking as I do, spread the word. I'd like to tell you all about it, but I can't peek the announcement next week. But we know that it isn't just a pollution problem. Greenhouse gases also pose a broader threat to our health. By heating our planet and changing our climate, they accelerate the spread of disease infections like malaria, dengue fever, and salmonella, which all peak during warmer months. To prepare for this threat, we're stepping up our surveillance of climate-related disease spread around the world, and we're constantly honing our national preparedness and response so that federal, state, and local government, business, and NCOs will be ready to work closely together if we do face a new wave of climate-related diseases. There's also another less direct connection between greenhouse gas emissions and public health. It turns out that a lot of the personal behaviors we've adopted that are bad for our planet are also bad for our personal health. We know, for instance, that depending on gas-guzzling cars to get us around heats up our planet, but it also harms our health since it leads us to get less exercise and increase our risk for cardiovascular disease. That creates a natural alliance between public health and environmental communities. I know that it's not typical that doctors and engineers sit around the same table, but in these areas, they're definitely together working on the same goals. You've already heard about the $80 billion in the Recovery Act for clean energy, but there's also a first-time historic investment to promote proven public health strategies to reduce obesity and smoking. And many of the strategies aimed at this prevention involve building more walkable communities, also turn out to be strategies for reducing the amount of carbon released into the air. Now, while environmental concerns have not always been the top priority for the Department of Health and Human Services, as we've learned more about the connection between greenhouse gas emissions and public health, we've been rapidly expanding our activities across the department. And we have some of our great leadership here today with us, and you're going to be hearing from some of them later in the panels. But from the National Institutes of Health, my Assistant Secretary on Health, the Centers for Disease Control is represented here today, and our Office of Public Health and Science. This is not an afterthought for the department. It's a natural extension of our public health strategy. And we intend to be collaborative partners in moving forward on a critical U.S. strategy. More and more, we understand that healthcare is not something that just happens in a doctor's office. Whether you're healthy or not depends on what you eat and drink, what you breathe, how you get around, and where you live. That's why even if our planet wasn't in jeopardy, even if energy independence isn't crucial to our national security, even if clean energy wasn't a huge economic opportunity, reducing greenhouse gas emissions would still be an urgent priority for us. It's a key to building a healthier country and a healthier world. And what we're learning is that the health of our planet and the health of our people are tied together. It would be hard for one to thrive without the other. That's why anyone who's interested in promoting public health should take on a new cause in help reducing the greenhouse gas emissions. After all, if you campaign to reduce pollution, you're also campaigning for lower asthma rates and lower rates of heart disease. If you lobby for a reduction in our dependence on fossil fuels, you're also lobbying for healthier and more active lifestyles. And when you argue that we need to slow climate change, you're also helping to slow the spread of infectious diseases. We can't afford to delay action. This is not a distant, abstract problem. This is the health of our children today, the jobs for tomorrow, and the fate of our planet for generations to come. We are eager to get to work. Thank you.
Thank you so much, Secretary Sebelius and Administrator Jackson, for painting such a clear picture of the connection of these two issues and the future we can get to on both energy and public health. At this time, we're going to open it up to questions from the audience. Please, when I call on you, we'll have someone bring a microphone to you, state your name and the organization that you're with. Okay, do we have a first question? Yes. Please wait for the microphone so that our people who are joining us online will be able to hear.
Hi, Geeta Pradhan from the Boston Foundation, Massachusetts. One of my critical questions is that unless, when we talk about the issue of public health or healthier lifestyles in communities, one of the critical connections is the issue of poverty, the issue of violence. And when we look at inner city areas, if you try to kids will not go out to play, parents will not send their kids out to play because of fears of violence. So it's not so much that there aren't good parks and playgrounds around, it's more an issue of poverty and violence. And I'm wondering how you're thinking of the connections of those issues with the issue of health and energy.
Well, I think that's a very good point in terms of the connection between health and certainly neighborhoods and safety issues. I think there are strategies that will be in place when the prevention efforts are put into communities around the country to try and measure what works, because we're bringing teams together of city leaders, health leaders, education leaders, and others to look at some of those very issues. And we want to make sure that some of the investment dollars go into the most difficult areas to really figure out strategies. So addressing safe neighborhoods, addressing the so-called food deserts is a piece of the puzzle. Often in lower economic areas, it's wonderful to say people should eat healthier foods, but lack of access to fruits and vegetables, lack of access to fresh foods often make that very difficult. So we have a strategy with the Department of Agriculture to address that. And I think finally schools can play a critical role. In way too many schools, there has been an elimination, I would say, of various kinds of physical activities as kids move more toward a testing protocol, and reintroducing a whole series of health strategies into schools, into hopefully that safe environment gets us a way down the road to making sure that kids, at least during a portion of their day, get physical exercise, healthier foods, in a safe and secure environment. So it's got to be a multi-pronged strategy.
Only things I'd add are that for you, then, the piece of the clean energy transformation that's equally important is the green jobs, the potential for real job creation in communities. I mean, the way to end poverty is to have a job. And so, we're here to talk about public health, but that's an important component. We just didn't emphasize it in our remarks. The second thing I'll say is I absolutely agree that it's not just poverty and violence that keeps kids inside. If you have asthma, going outside to exercise could send you back inside, sometimes to the doctor's office. And so I think part of the strategies I know the First Lady talks about when she focuses on kids is finding ways for kids to be physically active, knowing that there might be some challenges in their outside environment. You can be active inside. My asthmatic son is now a swimmer, and the reason is because that was a great way to build up those lungs,
Great, thank you. Yes, here in the front. We bring a...
I'm Minister Robert Cameron from the Rogers Road Eubanks Neighborhood Association in Chapel Hill, North Carolina. When we talk about walkability, when we talk about public health, when you're in an area where there's no infrastructure, where there's no sidewalks, where the speed limit is 40 and 45 miles an hour, where young people are getting off school buses and they don't have the sidewalks for safety, how do you encourage safe activity for youth and elderly that have to use those infrastructures that does not give them access to safety?
Well, I think it's a great point. And again, it's a conversation that's going on right now with the Department of Health and Human Services and the Department of Transportation, where some of the opportunity for investment in transportation will be linked to sort of the healthier lifestyle, healthier community, reducing the carbon footprint of buses and cars by investing in the kind of infrastructure that you've described, doing everything from rails to trails programs to additional sidewalks. Some of the investment that will come out of the prevention dollars that Congress made available and the President made available through the Recovery Act is going to do just what you suggested, is look at ways to make neighborhoods more walkable, have opportunities for outdoor recreation and safe venues, because you're absolutely right. It's one thing to say to kids, you need to get more exercise, you need to walk, but if you can't walk a mile from where the bus drops you off to home without going across 4 lanes of traffic, it's somewhat a ridiculous conversation. So I think there are some multi-agency strategies that are underway right now looking at how we have cleaner, greener, safer, healthier communities. And that really is the goal at the end of the day, to combine a lot of assets that are out there, but bring them together with that focus. I can tell you also the Secretary of Housing, Sean Donovan, is also a piece of this conversation. So as they look at investments in new housing opportunities, to also look at the green space around, look at the sidewalks, look at the neighborhoods, make sure that you're actually not only putting people in rooms, but have a livable space around it. So those conversations are very much underway with some of the new investment dollars.
Yeah, I'd only add that I just got back from my hometown, New Orleans, and I visited the community I grew up in, and looking at the rebuilding down there of a community that literally is almost starting from scratch. And we were remembering what made it a community when I grew up. We walked to school, church was down the block, there was a bus stop on, every other corner. We all knew each other because we took the bus to high school every day. And all those things are part of a sustainability program that EPA, the Department of Transportation, and Housing and Urban Development launched earlier this year. I am really excited about the potential for opportunities, Minister, like you're talking about, to come out, to line up federal will to help communities that are trying to rebuild a community, and not work against you. Because I think the complaint we hear is, if you can't help us, at least don't work against us,
Thank you. Yes, to
Prompted
this.
a few hands.
All right. We'll make our way around
Sure.
on the side. Yep.
Thank you. I'm Dan Greenbaum. I'm the president of the Health Effects Institute, and we're based in Boston and do work with scientists across the country on air pollution and health. One of the things I find, no matter who I talk to in any walk of life, I mention air pollution, and the next thing out of their mouth is, I was stuck behind this diesel bus this morning. And there's no question, uniform understanding that this is a problem for health, for asthma, for everything else that we're talking about here. And the agency has done a great job of putting in rules. The new diesels are dramatically cleaner. We've just completed studies on that very point. And there's lots of money, which the agency has moved very quickly to get out in the Recovery Act to start trying to replace the old ones. But it's still a drop in the bucket. I wonder how we work together to really rapidly move to get rid of the old school buses, which is a significant concern, much faster than even what we're doing today, as well as all the other buses and the old trucks. And there are some distributional issues here too, because the guys who work with sort of smaller businesses in the center of the city are the ones who have the oldest trucks. So they don't have the money to replace. So it's a challenge for us to figure out how to take something we know is a huge public health opportunity and move it as quickly as we can.
Thanks, Dan. I don't think that there's anyone on either side of the aisle. The fight for diesel pollution reduction is totally bipartisan. That's the other wonderful thing about it. Many pollution fights are, by the way. We had money in the Recovery Act, as you acknowledged, to put on the street to help on diesel emission programs. I am proud of the fact that we got that money out there quickly, but the reason we could is because there were so many people waiting for it. I think we were oversubscribed 6 or 7 to 1. The key are a couple things. Technologically, we need innovations that make it cheap. If you can't replace the bus, a lot of school districts are hurting, retrofit it. Make sure you're not doing any harm in doing that retrofit, but those retrofits, many folks are looking at that kind of area of attack. Public-private partnerships would be wonderful, and I know that there are some good corporate foundations and others out there. This is one of those problems where it's hard to just have a private industry. There needs to either be regulation or, as has been done in some cases for new engines, but for the older engines, we have to realize that there's going to need to be some public investment. And again, remember, 13 to 1. So that money we got, I think it was $100 million, 13 to 1. Thanks.
Okay, in the back. Yeah.
Hi, my name is Jessie Tolkien, and I work with the Energy Action Coalition, which is a coalition of 50 youth organizations across the country. I want to start by just thanking both of you for your extraordinary leadership. I think both in your current capacities and the work that you've done over your careers to fight for really this vision of what our country can be, how it can be green and how it can be healthy. And I really think that is part of the reason we see so many young Americans so excited to fight really hard for a clean and just and healthy future. we want to be your partners in this, and we see a lot of significant challenges kind of coming up against this vision that we're talking about. Political challenges, challenges from industries that aren't interested in changing. So I guess my question is quite simple, is how can we as a group of people enormously supportive of your efforts be your partners in actually getting to that future we dream of sustainable, healthy communities?
Well, thanks, Jesse. Great to see you. And right back at you. And right back at so many leaders and so many faces in this room who are indeed partners and who for years were the only fighters on this fight. We're glad to be with you at EPA, and we're thrilled to be back on the job on climate and clean energy. I would say that when I was in New Orleans, I also spoke to Tulane. That's my alma mater, so I got to go back home. And when I speak to students, when I speak to young people, I remind them of all the reasons this is good. But the one that's most important is, hey, do you want a job? Do you want a place to work? Think about the potential in the clean energy space. I meet folks all the time who want to be there. What's needed is the economic engine has to start turning around clean energy. When I think about where the jobs of this century will be, what's the next internet revolution? I think about clean energy. And so what we need is for you to, continue to have the voices that you've already been so successful in putting together. I think young people have historically always led environmental movements because young people are about optimism, and they see a vision for a future that they know is theirs. And so, we welcome that, but we also welcome any ways that we can educate about all the benefits, health, economic security, and jobs for a vision of a future planet.
Well, I think that Lisa said it very well, but in addition to the job space, which I think is even more critical as the mother of two 20-somethings, having a job is a big deal in this economy. So that's an incredibly important focus. I also think the other focus that your voices are probably the most compelling to talk about is what it's going to do to your own health and your kids' health. I mean, when we talk about the next generation, the impact that not changing the way we've done business before will have on your future and your kids' future is just dramatic. It will affect us a lot less. And I just think the kind of mobilized support that has been out there, that we saw all during the course of the campaign, the election, one of the things that's remarkable about 2008 is everyone wrote off young people. They will not do what they say they're going to do. They will not show up. They will not be involved. The young Americans defied that cynicism at every step along the way, and I think you just have to, this is your opportunity, and we want to partner with you because I think the team is out there, it's mobilized across the country, and it's all about change. And there are clearly, I've been dealing with this little issue called health reform. I don't know if any of you know that that's going on. But there clearly are a lot of people invested in the status quo. There are a lot of people in the energy space invested in the status quo. They have a lot to lose. They don't lose easily. So this is not going to be easy. But as the president likes to say, if it was easy, we would have done it a long time ago. I mean, this is a battle about the future, and I think you all are well equipped to take it on.
Okay, here in the front.
I'm Penny Newman, the Center for Community Action and Environmental Justice in Southern California. We have been impacted greatly by the goods movement. And my question is, how do we get the policies at the state level to coincide with this push toward new approaches, green industries? We have at the same time a push to reduce greenhouse gases, and yet we have a huge investment to expand infrastructure so that we can expand rail yards, trucks, all of it coming in from the ports. And what we've seen in a lot of the studies done in our communities is that even if we go to the cleanest trucks, the cleanest fuel, that the mere increase in the number of trucks is going to keep the pollution levels at the same level. We have in San Bernardino, where the cancer risk is 3,300 in a million, near the BNSF rail yard. Even if we reduce that by trying to do something with the rail yards, that's still totally unacceptable. And so we have conflicting policies taking place, and we have communities who are being exterminated. So even if we go toward 2020 to reduce diesel emissions, this community is not going to survive that. So how do we get our policies and how do we get the money directed, not just at expanding infrastructure, which a lot of the stimulus money is going toward, but toward those communities specifically, kind of creating these green zones where we put some real effort there.
Penny, it's good to see you. And you know, I think in some ways California is the heart of the problem, but also is way ahead on thinking about solutions. And I think we can borrow from some of the solutions we saw at the port. The good things that I saw when I was out there were, you know, a modest public investment in a company to build electric trucks that serve the port that resulted in that company locating its manufacturing of those trucks in this country, in the United States, to build electric trucks. They are short haul, they can't go far. You absolutely point out there is incredible challenge in the transportation sector. But when I see that, I know when Gina McCarthy sees that, who runs our air program, that means there's incredible opportunity there for real transformation. A lot of times when people think about energy, they think about power plants or refineries. But you know, the president's announcement about with the state of California and other states and car companies about their ability to move us forward on fuel efficiency and greenhouse gases on autos is just the beginning of how we can look at all aspects of the transportation sector. You mentioned locomotives. So I think it's keeping the momentum going, making sure that we push the technology envelope, but for communities in particular, which is what your question really focused on, I think you're right. We have to have interventions in the meantime, because while this transformation goes on, and while we say as sort of a big global issue, mass transportation of goods, moving goods movement to a more efficient model makes sense, we have to figure out the community impacts and how to mitigate it. Sometimes it's a matter, as you said, of creating green zones, buffers. Sometimes it's a matter of figuring out from a planning perspective where new expansions can and can't go. All that you've been a leader on in California has done some real hard thinking because the communities there are so well organized. And I think part of it is just having those communities have a seat at the table and a voice in the discussion.
Okay, we have time for one more question here on the side.
Good morning. I can't tell you how excited I am about this meeting today. My name is Donnell Wilkins, and I'm the Director of Detroiters working for Environmental Justice. And this is a really stimulating conversation. For me, as we struggle to revision our community and revision the region, revision the state, the city, all these things are really critical. The idea of bringing environmental protection together with health has been a long desire that we hold in our work. And one of the barriers to that is the reluctance or the inability of local health departments to sort of move along that direction. And I'm curious about your thoughts and strategies on helping local health departments and agencies sort of get on board and help change their behavior, because the focus so much is on individual behavior and change and not on the systems that you are representing today.
Well, Donnell, I think you're absolutely right that one of the challenges is to incorporate a new mentality throughout a sector of the community. So again, part of the opportunity with this prevention money is to put dollars into communities, but part of the effort will be to build a community infrastructure for health. And that will be a long-lasting legacy beyond the dollar invested. And I think it will be an opportunity You've got a lot of people right now, if you look at the education sector where the business community is involved and others are involved, and they take a real ownership. And, when we measure whether or not a company will relocate in a community, they often look at the test scores or look at the kind of schools there are, and that's a big measurement. We would like to get to the point where they look at the health of the community as part of the measurement, and that not only has to do with air quality and water quality, but it has to do with how healthy are the folks and what the likelihood is for affordable, accessible health care, and what are the opportunities to live a healthier lifestyle, kind of incorporate that. And the public health officials, I think, can be at the forefront of that. So part of what we're going to try to do, I'd like to remind people, in the Department of Health and Human Services, the good news is we believe in health and human services again. We're back. So hopefully that isn't just a sort of inside the beltway, but we take this responsibility very critically. And working with our public health partners, one of the side benefits of the flu pandemic is that very quickly we have developed a very robust relationship with state and local public health officials. They have been incredibly important partners. They've been an incredibly important part of the team, and we're not going to let that go away. I mean, that will continue to be a relationship as we move to these other challenges, to bring folks to the table and make it clear they are the public health leaders throughout this country. So strengthening the public health infrastructure and actually involving and engaging those experts in issues like this is really part of the mission.
Okay, well, thank you so much to all of you. Those were some excellent questions, and thanks so much to Secretary Sebelius and Administrator Jackson for your time with us this morning.
Great.
And at this time, we'll be joined by two leaders in the Department of Health and Human Services and the Environmental Protection Agency. With us from HHS is Dr. Howard Cole, the Assistant Secretary for Health at HHS, who comes to this administration from the Harvard School of Public Health and has been coordinating across the department in the areas of tobacco, HIV and AIDS, climate change, and obesity. And from the Environmental Protection Agency, Gina McCarthy, the Assistant Administrator for Air and Radiation, where they are taking strong steps to protect public health and the environment. Thank you both so much for joining us today.
Thank you so much, Mr. Carson, and it's so wonderful to see such an enthusiastic and full audience today. And I'm absolutely delighted to welcome you on behalf of Health and Human Services and thank all of my colleagues here from across the federal agencies and throughout the nation, throughout many, many communities across this country for your support of efforts to promote public health benefits of clean energy reform. We were delighted to hear these opening remarks from Administrator Jackson and Secretary Sebelius, and we have a wonderful start to this new collaboration and this new chapter for public health history. As the Assistant Secretary for Health, over the last several months, I've had the great privilege of helping to coordinate and integrate the scientific expertise within our department related to this area. And it's been a great honor to meet many, many scientific experts at NIH, at the Fogarty Center, at the National Institute for Environmental Health Sciences, at the Centers for Disease Control and Prevention. Our Assistant Secretary for Policy and Evaluation has been extraordinary in his support and leadership. But now this is an opportunity for we health officials to stretch beyond our health department, to reach out to EPA, and then also, more importantly, to everybody here, the community leaders gathered. And the fact that you are here today shows your willingness to stretch outside of your agency, to stretch outside of your community, to move outside of your comfort zone, and to build new public health partnerships for prevention and clean energy reform. I'm a physician. I have cared for patients for over 30 years, and I was trained as physicians are traditionally trained, that is to focus on treatment and individual biology of disease. But over my career, I've been very blessed and honored to gain experiences that afford me a broader perspective. First, as a state health commissioner from Massachusetts. It's great to see so many Massachusetts people here. And for you Red Sox fans, there's always next year. And now as Assistant Secretary for Health, it's just a great privilege to have this broad perspective and work with so many partners across government and across this country to promote opportunities for prevention. At moments like this, we remember that our health goal as a country and as a global community is to help all people reach their highest attainable standard of health. I love that phrase. And also to help all people realize true health, defined by the World Health Organization as, quote, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, unquote. That's what we're shooting for, and that's what we're aiming for with this new collaboration and this new partnership. Also, as the Assistant Secretary, I have the great honor of overseeing a national planning process complete with health goals and objectives called Healthy People. And there's a wonderful line in the Healthy People documents that reads, quote, the health of the individual is almost inseparable from the health of the greater community, unquote. And that's what this summit is all about, to talk about the health of the individual, but also its link to the health of the greater community. In short, we are all interdependent and all interconnected. And with respect to clean energy, for each person, we all can affect and are affected by the air we breathe, the food we eat, the vehicles we ride, the energy we use, the places in which we live, the health we enjoy, and ultimately the lives we lead. What thrills me now as one of your colleagues in this new collaboration is the focus on prevention. And we have an administration that has put so much priority on a critical dimension of prevention and wellness for our entire country. There are some who dismiss prevention as perhaps not as exciting as treatment, but there's a wonderful line from Dr. June Osborne, and she says, quote, when prevention works, absolutely nothing happens and things are very boring, ... Let us all pray for a little boredom. And when you see the situation we have with greenhouse gas emissions now, the challenges with asthma, heart attacks, premature death that have been described so well by the Secretary and the Administrator, the particular impact on minority and disadvantaged populations, the increased risk for natural disasters and threats to our air quality and our water quality, as just some examples, we want to promote prevention and have a new chapter to protect the future. Also, we love this emphasis on change through this new collaboration, working through health in all policies, as the Secretary has noted, because there's a wonderful saying again that if you always do what you've always done, you'll always get what you always got. And we're trying something new here, which is reaching beyond our traditional departments and areas of interest to new colleagues to promote health in all policies, the so-called social determinants approach to public health. Just to cite two examples, you heard from the Secretary about the example in the 1996 Olympic Games in Atlanta, where when vehicle traffic dropped almost 25%, there was a subsequent drop in ozone levels and also childhood asthma incidents for that period of time. But just to amplify that, once those games were over and traffic went back up, we saw the asthma rates go back up too. So there's opportunity and challenge in that story because we know we can promote prevention, at least in the short term, and the challenge now is to make it sustainable. A second example, which is very recent, comes from the New York City Harlem neighborhood, where a not-for-profit community group known as We Act has launched a new clean fuel, clean air campaign to improve air quality. Harlem has some of the highest hospitalization rates in New York City, and many of the city's bus depots are located in northern Manhattan neighborhoods, including Harlem. And these residents were concerned about the negative health effects they experienced as a result of living near the bus depots, including noise, soot, and fumes. This group was able to convince elected officials to mandate that the city's Metropolitan Transportation Authority buy hundreds of alternative fuel buses and retrofit the diesel depots. And the group is now working with city leaders and the Transit Authority to design and build a green, neighborhood-friendly depot that will house more energy-friendly buses. So these are just a couple examples of prevention at work and prevention at work at the community level. And we remind everyone again that the health of the individual is almost inseparable from the health of the greater community. Well, we hope to hear from all of you, because you are all leaders in your communities and you have so much expertise. In these breakout sessions are examples of how we can make a difference in public health and prevention with respect to the health benefits of clean energy, the health impact of vehicle emissions and transportation, and most important of all, perhaps, building strong, healthy, and resilient communities that will sustain public health for the future for all people and help all people reach their highest attainable standard of health. So this is a great opportunity for all of us and for me personally, and thank you for including us in your partnership. And I am also delighted to have as a renewed partner Gina McCarthy, who was a wonderful partner for me in Massachusetts when I served as Commissioner of Public Health, and she was there as the Deputy Secretary in the Department of Environmental Protections. She went on to bigger and better things as the Commissioner of the Connecticut Department of Environmental Protection, and now, as you heard, is the Assistant Administrator for the Office of Air and Radiation for the U.S. Environmental Protection Agency. It was just a joy for me to come to this new post in D.C. and be reunited with Gina. And I think it's a sign from above that this collaboration is going to be off to a great start. So, Gina, thank you for being here, and thank you for your leadership and your partnership. And please join me now in welcoming Gina McCarthy.
Howard, it's great to be up here again and share the podium with you. I'm really excited to be with you again, and I wanted you to know before you have to take off is that we've decided to have a fourth workshop. It's actually to discuss Bill Belichick's decision in the Pats game against Indianapolis. It deserves a workshop in and of itself. I'm on the negative side. I don't know how many join me here. There you go. Terrible decision. But anyways, thank you, Howard. It's great to have you here. I just want to, at this point, echo the administrator and the secretary in welcoming you. I am so excited to be here. The best part of today is that we are talking about clean energy, and we have Health and Human Services and the Environmental Agency here. How cool is that? You know, it really is about time that we recognize that energy policy is environmental policy and that health policy is environmental policy. And we could go on and on and on. I think you get the point. And I'm also excited because for so many years, I've worked with so many of you, either as individuals or as your organizations. As many of you know, I started out at the local level. For 11 years, I was a public health official. I just couldn't figure out what that meant, so I started getting involved in environmental issues because it became so apparent to me that as hard as we worked on some of the local public health issues, that the environmental issues could trump it all. You know, they could just so set us back in terms of air quality. You know, you're working so hard on an individual basis and you realize that it's just not good enough, that you didn't have the reach that you needed. And I began to get involved in so many things that sort of drew me to the world at the state level in the environmental issues. In particular, issues around siting of hazardous waste facilities, things that could really put a damper on your day if you lived in a community where one of those were being proposed. And it just kept going on and on from there, and I've been blessed by the time that I have spent with you and by the understanding that you've given to me, and the world is blessed by the work that you do. And really today is all about how do we get the feds to step up to the plate and to get real and to understand what we need to do to make real things happen in real people's lives. And so I'm excited to be here and with the colleagues that you're going to be talking with and listening to and engaging with, because what we're all about is making you more successful. What are you doing and how are you reacting and interacting with the federal government in a way that we can enhance your success and get real life changes on the ground? Now, I will tell you, Kathleen Sebelius and Lisa Jackson are two women that you do not trifle with. And when Lisa Jackson comes and says to me, you know, I keep talking to all these environmental justice constituents, and I agree with everything they're saying. What am I delivering? Then I come in and go, oh, good question. It's really about turning their commitment, their understandings into real life changes. That's what my job is. That's what Howard Koh's job is. And our job is to do what the Obama administration is telling us and our bosses to do, which is not just think outside the box, because for many of us, that's easy. It's working outside the box that's hard. Is how do we work across agencies in a collaborative way so that you don't ask people, individuals, to make choices in their lives that no one should be asked to make. We should not have a choice between breathing clean air and turning our lights on. We must reject that as a choice that we give to the people that we serve. It is just ridiculous to think that in this day and age that we can't have it all. We must have it all. And I know that many of you people have worked at the community level. You've worked at schools. You've worked at businesses. You've worked at homes, trying to understand how you can bring all these little dissecting missions and goals that the federal government and state government lays out in a wonderful bureaucratic fashion and figure out how to make it all work. Well, my job for many, many years has been to be the worst bureaucrat I could possibly be. And I have been so successful. But finally, I'm in an administration that's telling me to do that. They're telling me to work with the Energy Agency and to tell them why energy policy needs to be crafted in a way that achieves our Clean Air Act standards. That's the mission that we have together. And your job is to keep us real, to stand up and tell us what's going on in your communities, to tell us about school buses and what we're supposed to do in our local schools to make schoolyards safer again. And as Derek Crandall knows, my job is to remind you that if kids can't go out and play, and it's not healthy enough and safe enough to go out to play, then I will never have them vote for the next reauthorization of the Clean Air Act, because they won't know why they are bothering. Because if all they do is stay inside, they won't care. And we have to have people who care, because in the end, that's what it's all about. I don't fight people who disagree with the goal of Clean Air Act. Who disagrees with breathing healthy air? Let's bring that back now. What? It's really hard to disagree with that, but I'll try. What I am fighting is two things. is the lack of understanding about how to get there. And the other thing is we're fighting apathy. We're fighting all the people who won't stand up and recognize that there is a tremendous need for us to work together, to work collaboratively, to combine our missions as agencies, to understand that my mission will be better served when I start thinking about my mission as also Health and Human Services mission. I will do better in the long run if I think more broadly about what I'm trying to achieve and I make that work for individuals. So our goal today is to challenge you to tell us how to make you more successful. It's to tell us how to get real, to not just think outside the box, but to take actions that are way outside the box. Because that is what it's going to take for us to serve our communities and to serve our individuals and to hand our children a world that we will be proud of. So, our job today, and my little job right now, is to tell you what you're going to do next and who's going to lead you into that. And now I'm going to do the fourth workshop. How many people are going to join me for Bill Belichick? All right, it's a small group, but we're going to be really good at coming back and telling you what our opinion is. The first group is actually, we have 3 different workshops. The first one is Health Benefits of Clean Energy. And I want to introduce to you the people who are going to help lead that effort. We've got Janet McCabe. Janet, if you wouldn't mind standing, she's the Principal Deputy Assistant Administrator. She works with me at Office of Air and Radiation. As you will see from Janet's biography, she's a horrible bureaucrat as well. She actually comes from working at a small nonprofit that focused on children's health issues. How dare her then move into the Environmental Agency? And we've got Linda Birnbaum. Now, Linda is the director of the National Institute of Environmental Health and Sciences. Now, Linda is the worst bureaucrat of all kind. She worked for 16 years at EPA. How dare her, working on toxics issues, and now she's at NIH. Who ever heard of such a thing? So as you can see, as I introduce these groups, our whole goal is to help you realize that this administration is here to think differently, to not go with business as usual. Our business as usual is not going to be the past administrations or the administration before that. We are going to chart a new course with your help. So the second group is Health Impacts of Vehicular Emissions in Transportation. Is Lisa Heinzeling here? Oh, there you are. I'm sorry, Lisa. Stand up. She's the Associate Administrator for Policy, Economics, and Innovation at EPA. And we've got her partner in crime is Roger Glass. He is the Director of Fogarty International Center at NIH. Thank you for being here. You folks, these are heavy hitters, folks. You have to get in their faces when you see them, right? Tell them what you've been wanting to tell them for many years. And our third group is Healthy and Resilient Communities. And we've got Thomas Frieden, who is the Director of the Centers for Disease Control and Prevention. Where are you? Is he here? He's coming in for the session? Okay. And we've got Pete Silva, who doesn't mind jumping up and telling me that, who is the Assistant Administrator for the Office of Water at EPA. And so those are the leadership teams that will help you with your workshops. Now that I've explained that we hate bureaucracies, I'm going to break you up into 3 separate groups who are all obviously related to one another. So as you're in these groups, feel free to explain why you would have liked to have been in the other group and the vision you have for that as well. Don't let us get away with this. Do what this group is supposed to do. Challenge us, tell us how we can work better with you, take advantage of the leadership that we have in these agencies, because I don't think you're going to find a better time or more receptive people who want to have a clean energy vision, who want to have a vision that Howard outlined for people to be as healthy as they can possibly be. And I know in my world, if I don't figure out how to align policies across this administration to address the issues of climate, there is no other issue or of importance that we are facing that more strongly screams out for a collaborative, multi-agency, broad-thinking approach to how we build our world, How do we get to that vision of the future that gets all of us where we need to go, that builds healthy communities, that builds clean schools, and that answers the question, did you have a question?
Yes, first of all, Gina, how you doing? I just wanted to say that I really appreciate the new EPA and you guys stepping up to the plate, and your visit down to Houston, Texas, and to Dallas a couple of months ago. It was a pleasure meeting with you, but I just want to stand up and say on behalf of citizens in Port Arthur, Texas, and along the Gulf Coast, where there's tons of refineries and chemical plants, we appreciate what you all are doing, and we appreciate this new focus on health and cleaning up our community. Thank you all.
That is so nice of you. Thank you. Well, public health is what it's all about, is it not? Environment is, we are here to serve the interests of the natural world, including the two-legged people who walk around and really need our help. And because the world deserves all of our attention. Thank you so much. I actually was out there a couple of times, and one of the great things about taking this job is that you actually get out of New England once in a while, and you realize that there's a whole big world out there. And some of the worlds I'm seeing, I actually took a helicopter flight up and down the port, and I was so shocked to see refineries that actually had a footprint that was 3 times the size of Houston. The footprint of that one refinery. The challenges we have out there are enormous because in between those refineries are communities. They're individuals, they're schools. They are human beings who are struggling to not just to survive, but to create a world for their own children, a world that's healthy, and where they can go out and play, and they can feel confident that they're breathing the air that they deserve to breathe, which is clean air. So it's really exciting to be here. I am going to actually turn the podium over to somebody who can tell you how to get where you need to go, which would really be helpful. Greg Nelson is here, and he's going to tell you the logistics from now on. I will come back, but I have to go because the boss is calling me to a meeting. And I'm looking forward to the workshops, to how successful you are in grabbing us by the ear and telling us what we need to do for real life, in real life, for real people. Thank you so much.